So I was an invited speaker, and my group at MIT, we kind of invent artificial intelligence and machine learning technologies for many health-related problems, and some of our work overlaps with oncology. So today in my talk, I shared 3 examples of my research at MIT. One of them was to generate images which allow physicians to do computational staining of pathology slides at the point of care. So these are algorithms that can take photographs of unstained tissue biopsies, and the algorithm can then computationally H&E dye stain it without using the tissue. And then we also have algorithms that can take existing photographs of stained tissues and destain them. So this allows physicians to not use biopsies at the point of care and use photographs instead to make some decisions. I also shared some of our work in reducing toxicity in end-of-life glioblastoma patients. And we have a digital algorithmic system that makes dosing recommendations for these patients, where the machine learning algorithm determines the fewest amount of doses that these patients need to shrink their tumor without experiencing toxicity. So these are new digital clinical trials, clinical algorithmic systems we invented at MIT. And in the third part, I talked about regulation, inclusivity of AI and machine learning, and how we should regulate this technology, what are standards, ethics, explainability of this new technology. So oncology care physicians who come here, patients, foundations, government agencies who we work with can benefit from AI without having to worry too much about all these other issues. I think there's a broader conversation of ethical conversations, but in medicine, I think some of the key conversations are the data sets on which your algorithm trained inclusive of all the patient populations that usually suffer from that disease? So more than ethics of AI, I think ethics of humans is also being examined here, that it's not that humans currently have done the most ethical things in some of our clinical decision-making systems. We still operate with small data that's available and do the best we can. I think in machine learning systems, we have a chance to get rid of the biases and create a new way of ethical algorithmic interventions. That's one. And second is obviously when an algorithm makes decisions, are those decisions recommendations to a physician, or are they actually actions that the algorithm is asking the physician to take? And that should be carefully separated out. So I think we have shown some work actually today in the talk that we have personalized dosing regimens for many of oncology patients, where the machine learning system can learn individual patient characteristics. And after learning that, it can make recommendations for personalized precision medicine dosing. So that's one of the advantages of using machine learning in some ways, where human physicians may find it hard because of the time constraints or the large amounts of data they have to process, or because the pharmacological development model that was given to them didn't consider those things. So machine learning can help you get around some of those things. Right. So in my research and my group at MIT, we broadly work with patients and foundations and individual citizens. And I should mention at the beginning, I have no conflicts, no significant financial interest. We are trying in the next 5 years to create benchmarking for some of this work and allow people, make the technology more accessible, explainable, safer, inclusive, and make it really useful for patients and physicians who need it. That's like a broader vision. And in the field, I think there are internal conversations about how do we make sure machine learning and AI impacts people in different fields like this community, where they might want it, but they don't know how to access it. And how we can learn from this community of clinicians and physicians as machine learning people, what we need to do in our research in our groups to make sure that we invent technology that's scalable.